Shoulder arthroscopic instability surgery is done for patients that have had an injury to their shoulder joint, in which sometimes the shoulder pops out of the socket or dislocates, and then the shoulder becomes quite unstable, and the only way that we could reduce the chances of the shoulder becoming unstable or dislocating again is to perform this arthroscopic surgery. Most of the patients are a younger population that need this surgery. They're going to be in their teens and to early 20s. Those patients, unfortunately, once they dislocate their shoulder from, for example, an injury in football or another sport, or even a fall, once they dislocate their shoulder, they have a much higher risk of dislocating the shoulder again. Especially if they have two dislocations, then the rate goes up even higher. The younger the patient, the higher the dislocation rate. There are various methods to performing the surgery. Not too long ago, we used to perform the surgery in an open fashion with a fairly large incision in the front of the shoulder to stabilize the shoulder. Nowadays, we have switched pretty much all arthroscopic surgery, in which we make little tiny incisions and we're able to insert a camera so we could look at the structures in the shoulder and make repair of those structures that have been torn. That's usually the standard of care now, where 15, 20 years ago it used to be a big, open incision. The minimal invasive and arthroscopic surgery allows the patients to recover a lot quicker now, and they have less pain after surgery. This surgery is actually an outpatient procedure in which the patient comes into the hospital and they go home the same day. The recovery for arthroscopic shoulder instability surgery is usually about 4 months total. And that essentially starts in a couple of weeks. The patient will start physical therapy. They'll be in a sling for about 5 to 6 weeks, and that's to allow the repair to take and to heal. They'll start very gently with some passive range of motion exercises, meaning that therapists will be moving the shoulder for them. We don't allow the patients to lift anything heavy for at least 2 months. That's to allow everything to heal properly and prevent a dislocation while the tissue is healing. By 4 months, we allow the patients, as long as they meet the certain criteria, we allow them to return to sports, return to full duty in their job, whatever job they do. But usually it takes about 3 to 4 months to recover. The nice thing about the surgery is that it decreases the dislocation rate by quite a lot. It's never zero, but it's much better than almost 90 to 100% in some cases for some of our patients that don't have surgery.